Okay, so everybody here knows who I am, right?
Professor Justin.
Professor Justin. Yeah. So, posture. This is obviously kind of the backbone of what I do as far as being a massage therapist. I'm not really a big fan of even calling myself a massage therapist because I'm more of like a bodywork specialist or a posture specialist. In any case, posture is basically the foundation of how to tell what's going on with someone. You can literally like read someone's life just by seeing what their posture is like. Okay, and we're going to go into understanding first some key terms, all right, to really see a few layers down to understand how the posture is affected, and then kind of see what you guys have going on, all right. And I brought out my postural analysis chart, see if anybody wants to see what's up with their bodies going on, and then we can take some course of action to go from there. Okay, so first of all, what is posture? All right, it's a human position, assuming a neutral spine. Okay, so the first term that I want to go over is tensegrity. Basically, what this means is the body is always under a specific amount of tension and pressure in a very specific system that evens each other out. So when the tensegrity gets compromised, that's when you start to have problems with chronic holding patterns, okay, or postural deviations. All right, so a deviation is created from either trauma and it causes imbalance in the psychosomatic tensegrity system. Energy runs in certain systems or meridians throughout the body. These are the 7 lines or meridians that the fascia runs through. Okay, now fascia kind of interconnects everything, specifically or most dominantly the central nervous system, the circulatory system, and the skeletal muscular system. Okay, so all these three play a major role in affecting everything else as well. So fascia is a conduit, connects kinetic energy, muscle contraction, emotion. Okay, now the nerves, the capillaries, and the collagen fibers are basically what fascia is made up of. Okay, now the nerve signaling to the muscle tissue primarily takes place here, much like a highway artery. Okay, so on the top of the muscle, so on the top of the muscle here, we have a layer, like a sheath. Like I like to use the example of a chicken with the little skin on the chicken. Okay, that little skin is a fascia. All right, so you have that layer. Okay, but we also have layers of muscle tissue. Okay, so we get deeper into the muscle tissue, and then we have another layer of fascia that connects those two blocks of muscle tissue. Emotional responses induce specific muscle contractions, primarily from the autonomic nervous system, much like digestion. Okay, so this really kind of emulates more like the other side of muscle contraction that we don't really think about. About 70% of the muscular contractions that we do are subconscious. They're automatic. If you have like a lagging body part, or if you have a area of your body that just feels tight all the time, or like when you get out of bed, if you're just achy and everything, pay attention to that, because that's your body talking to you and telling you something. All right, and just toughing it out and fighting through it does not work. We have to address it, and the body will always tell us what we need or what we want. A lot of times we just don't listen because we're too busy or we're just not thinking about it. Okay, so I'm gonna use this as an example.
Yeah.
Okay, I'm gonna go ahead in front of the postural analysis chart here. All right, go ahead and face towards the chart. Okay. So I want you to just kind of march in place for a second. Just let everything go. Relax everything. Okay, relax it. Okay. Now, what you want to look for here, all right, is to see if the Achilles tendon is straight. Okay, on this one looks straight. This one, however, you can see there's a slight little deviation right here, right where the ankle is. Okay, so that would indicate a slight pronation of the right foot. Okay, it's not bad, but that's coupled with a lateral rotation, which would mean that there's issues in his hip. Okay, and I'll get more into that when we get into the rest of the deviation.
Yeah, he knows about that.
Yes, I do. All right. There's a difference between it being slightly pronated and overpronated. Okay, overpronated is when you have problems. Okay, slightly pronated, just get a good orthotic, or even just honestly get like a foot massage, or you can take like a golf ball, or even like a ball, make like a ball of ice, and roll your foot on it, because normally the plantar fascia ends up being really tight, so you can reduce the inflammation down there and help that out too. Okay, so that cause obesity, pregnancy. That's not really a whole lot you can do about that. Improper footwear. Now that is a big one. A lot of people don't wear the right kind of shoes, and that's an easy fix. I know I wear orthotics because for my days in the military, like especially when I was doing like rough runs with combat boots on, repetitive pounding on hard surfaces can weaken the arch. So you just want to make sure that you have the proper kind of support for the arch in your feet. Okay. Stretch the foot and tightens the calf muscle. That's a big one. Okay. A lot of it, especially women that wear heels a lot. Okay. The calf ends up getting kind of like locked short. All right, and because the Achilles tendon is so strong, that ends up causing a lot more problems all the way up the chain. The way that the foot works, when it plantar flexes, it also internally rotates. So your foot basically kind of works like that and comes like that. It doesn't just go back and forth from left to right, okay, because the way the muscles are configured there. So normally, if you have this going on, you also have a rotation. Okay, now when this happens, as you can see, all right, this kind of falls in, which throws the ankle off, which makes the knee have to compensate. Okay, which is going to put strain on the MCL. And when that happens, okay, the femur is going to rotate in, which is going to put a strain on the lateral hip rotators, which is going to put strain on the lower back, which is going to put strain on the neck. So you see how everything kind of is interconnected. Deviation number 2, anterior pelvic tilt. This virtually almost everyone that I see or everyone that I know has it. Our hips are usually off a little bit. It happens because this is where our bodies take the most brunt. Sitting too much, not stretching. Really not stretching is like the biggest thing. Sitting too much will do it. However, overtraining the piriformis or just not training properly, period. Especially like a lot of people that are training with those super tight waist trainers or that wear like belts all the time, that'll actually weaken the integrity of the pelvic muscles. Okay, so you want to be able to when you're training, especially heavier, to actually control the contractions of this area. You don't want to just suck in and then okay, now I can relax and it's going to do the work for me. But the body doesn't work like that. Okay, because if you're not contracting it, then you're not sending those electrical impulses into the muscle. Okay, so the fascia will get thicker and tenser, and it'll compensate. People with a really bad anterior pelvic tilt, if you look at it from the side, it kind of looks like you can see a little like dip right here. All right, so if that's going on, of course, you got some stuff going on. But the tight hip flexors are superficially, that's no good. However, the psoas is the real moneymaker. That's the one that's always just really tight, and your piriformis. So what happens is the pelvis rotates this way, okay, and also that little dip in. Remember when you were getting ready for the show? That little dip. This is what I was talking about here. Yeah. That little bone right there, it's protruding just slightly, so you could be 4% body fat, but you're still going to have that little lump. Okay, and when that pulls down like that, it pulls the hamstrings up. Okay, so now the hamstring is being stressed, and that causes inflammation right about this area right here. Okay, and then it also causes this to become tight, which the fascia at this junction is super sensitive. Okay, so now the gastrocnemius, or the outer calf muscle, okay, attaches right about here, So then the fascia will kind of extend the tension onto there to compensate. So then that's going to be pulling on that, taking away from down here, okay, which is going to shorten the calf muscle even more. Okay, so those two usually work hand in hand. All right, and as you can see here, the everything in here gets affected from the ones that are most commonly complained about is usually like low back pain or the low back extensors here, QL. All right, and then the hip, the deep hip rotators, which actually aren't shown here, but they're on the outside right here. Okay, those usually scream like pain at first. So if you can actually do it on yourself right now. Just kind of come right to where your hip bone is, right below it, and just kind of move back and forth and press. And if it feels like tender, then you know that you have some compensation going on there. I know mine was like that all the time.
Telling me I'm messed up.
Right?
You're gonna walk out.